The second part of my lecture is the photographs, which is another important diagnostic aid and can be divided into an extraoral and intraoral photograph. The other diagnostic record is the facial photographs. So facial photographs, they are the easiest to store and occupy the least amount of space and provide immense information to the clinician as well as the patients. So we have two types of photographs, either extraoral photographs or intraoral photographs. So we have to take both, and they are very useful. So extraoral photographs are considered essential records and should be taken before and after completion of the treatment. So we have to take before and after the completion of treatment to the profile, to the front view, and we can take a smaller region to see the change in the smile, teeth relation, and incisor show. So this is the before and after, and this. So what are the uses of extraoral photographs? So they are used for the evaluation of craniofacial relationship and proportions before and after treatment. From the legal point of view, we have to take a photograph, and for the assessment of soft tissue profile, for example, in these cases. So we can assess whether the patient have a convex or a concave or normal profile with the aid of photographs. So usually with the class 1 malocclusion, we have a normal profile. With the class 2 malocclusion, we have a convex profile. And in the class 3 malocclusion, we have a concave profile. So in this case, photographs of the profile is a useful tool for determining and assessing the soft tissue profile. The other use of extraoral photographs is the proportional facial analysis and or photographic analysis. So when you have a frontal view, usually the face is divided into 5 parts. And when those parts are equal, then we have a symmetrical face. Vertically also the face is divided into 3 parts. So we have the upper, the middle, and the lower facial height, which is divided into 1 and 2/3, 1/3 and 2/3. So when these thirds are equal, then we have a symmetrical face. And the profile, we can assess the lower facial height, whether it is normal or an average, or decreased or increased. So always extraoral photographs, they are useful in proportional facial analysis and or photographic. Also, extraoral photographs can be used for detecting and recording facial asymmetry. So it can be seen here that this patient has facial asymmetry, and at the end it's a way of identifying the patient. So you can know who is the patient for each case. So this is an extraoral photograph. So what are the guidelines for these extraoral radiographs? First is quality. And the standardized facial photographs is either black and white, which was in the past, or color prints. And the patient's head should be oriented accurately in all 3 planes of space. One lateral view facing to the right with serious expression. Lips are closed slightly to reveal the muscle imbalance and disharmony. Background should be free of any distractions. The background most likely is white and should be clear of any distraction. And the eyes are opened and looking straight ahead. And these are the extraoral views which we normally take. First, we have the frontal view, the lip relaxed, and the profile view. And again, the lips are relaxed and closed. And the three-quarter view with the lips relaxed and closed. And we have the frontal view smiling. So usually we take these intraoral photographs. They are considered non-essential diagnostic records, yet they are simple to take, maintained, and stored, and of course useful. This is because they are neither standardized nor three-dimensional. So intraoral radiographs are a useful tool and also can be used in the diagnosis, and sometimes it can change the treatment plan. So what are the uses of intraoral radiograph? First, it's helpful in explaining and motivating the patient. And they are also used to monitor treatment progress and results. So we can always explain to the patient what's happening. So what's the type of malocclusion, what we are going to do. For example, here we can tell the patient that you have a shift and the midline, so we have to correct this shift for this reason. We have to do so and so, and in this case we have a central diastema, and usually the central diastema is caused by high renal attachment. So we can explain to the patient and show him the renal attachment, which will be eventually removed during orthodontic treatment. So we can explain that we are doing so and so. So it's important. And they are also helpful in medical legal cases involving the texture and the color of teeth, especially preoperatively. So sometimes like the patient develop a white spot lesion or caries, and sometimes it happens before and we didn't pay attention. So for this reason, we can show the patient what happened and the pre or before photograph, and we can compare the results. And also it's important for assessing and recording the health and the diseases of the teeth and soft tissue structures, like in these cases where there is gum recession, there is a gingivitis and swelling. So it's also a useful tool, and we can explain many things with these photographs. Thank you for listening.